My friends, if you know me, you know it brings me no pleasure whatsoever to tell you that we unfortunately are seeing exactly what I've been expecting, which is that the case spikes in coronavirus in what I guess we're calling wave three, even though I know we never really got past the first wave, but at least we can call it spike number three. The case spike was inevitably going to lead to a spike in deaths. And it's happening. I would love to have believed it wasn't going to happen, but there was no reason to believe it wasn't going to happen. And it's happening. Yesterday, 1,225 more people died in the United States of coronavirus. And we now are seeing the leaders in terms of deaths, California, Texas, Florida, no surprise, as some of the largest population states. Also Illinois, Ohio, and Kansas. This is the highest number of reported American deaths in one day, dating all the way back to August 26th. And now, even when we look at a 7-day rolling average, which shows us the sort of general direction of the numbers, a very clear uptick in the number of deaths. The total number of deaths now through the pandemic in the United States, 227, nearing 228,000. Now, remember, this matters because we saw the Trumpian right saying through spike number two, and as we have entered spike number three, that cases may be up, but cases are up only because of testing. Now, when we looked at the number, we saw that that wasn't the case. But they would also insist we're not going to see deaths go up because it's younger people getting sick who are less likely to die. We're better at treating it. It's a less serious strain and or various combinations of these and other ideas. Well, some of it is plausible. I mean, it's plausible that the deaths won't go up as much as they might have with this number of cases if they were in April or July, because we do have some treatments that have been shown to be effective in helping prevent death in some of the most serious cases. It's true that at least over the summer, we were seeing sort of a push towards younger people being the ones getting infected because I guess older folks were taking it more seriously. But clearly, when you have this number of new cases, you are going to see a spike in deaths. And we are now heading, I mean, we can't ignore it. We can ignore it. Trump has been trying to ignore it, but it would not be prudent to ignore that we may be heading towards the most difficult phase of American life from a public health standpoint, maybe in 100 years in the United States this fall. And when we talk about wave three, it is true that we've not really had a break since wave one, but maybe spikes are the right terms. Recall that we had spike number one in mid-April to about 35,000 cases a day. And then we got down to 20,000 cases a day and things started to reopen. And that caused a second spike in mid to late July of about 75,000 cases per day. And then presumably, thanks to some social distancing guidelines being observed, and then also the fact that because it was summer and warm in just about every part of the country, people were spending more times outdoors, we saw cases start to decline again. But this time, instead of dropping to 20,000 a day, the bottom was only about 30,000 cases a day. And then once again, now we are on the upswing, regularly seeing 60, 70,000 cases per day. They told Fauci he was crazy when he said we could see 100,000 cases a day in the fall into winter. And indeed, if you look at the trajectory, we may well be heading to 100,000 coronavirus cases per day. And the reality is that even with a lower death rate, which hopefully we would have compared to the spring and summer, because of better knowing how to manage cases, we could easily end up with 1,500, 2,000 cases a day. And this is very quickly getting very, very ugly. Now, Donald Trump will tell you, given the opportunity to go back to February, January, February, March, he would not do anything differently when it comes to dealing with the virus. And in fact, he said it directly on a town hall with Eric Bolling just about 48 hours ago. Take a look.
With COVID, is there anything that you think you could have done differently? If you had a mulligan or a do-over on one aspect of the way you handled it, what would it be?
Not much. Look, it's all over the world. You have a lot of great leaders. There are a lot of smart people. It's all over the world. It came out of China. China should have stopped it.
Donald Trump would not have done anything differently. Now, it is true that European countries and countries in other parts of the world, Argentina, for example, are seeing huge spikes as well. But we're looking at our country and we're looking at whether Donald Trump's handling has earned himself a second term. And the answer is obviously no. Now, one other difference between the United States and other countries is, I know we never really got past wave one, but if we use the terms spikes, we are heading into spike number 3. The spikes we are seeing in places like France and Italy, as examples, these are their second spikes. So while their second spike, much like our second spike, is worse than their first spike, we are already on spike number 3. And therefore, we're not even comparing apples to oranges anymore when we compare what's going on in other countries. We are now comparing apples to oranges. We're really comparing apples to yak meat, to be perfectly frank, because the situations are so different and the handling has been so different. And when you look at what's happened here, when you've seen Trump and Republicans ridicule those who wear masks, Trump even ridiculing Joe Biden on stage in the first debate, when Trump, in all likelihood, had coronavirus already, we need a change. And what is Thanksgiving going to look like in 4 weeks if this spike continues to grow? It's horrifying to think about. And we have we're waiting for a vaccine, among other things. And we have some really important vaccine news, which I want to talk about next. This episode is sponsored by Blue Chew. One of the things I make a priority on the show is not to perpetuate stigma for things that don't deserve it. We've talked about mental health. We've talked about many things where we should all just be respectful adults, period, and we would be better off. And Blue Chew can increase performance and give you that extra confidence you may be looking for. BlueChew.com, blue like the color blue, is the first chewable with the same FDA-approved ingredient as in Viagra and Cialis. It can be taken day or night, even on a full stomach, since it's chewable. Blue Chew is prescribed online by licensed doctors. You don't have to go to a doctor's office. You don't have to wait in line at a pharmacy. It ships right to your door in a discreet package. They're made in the USA, and since Blue Chew prepares and ships direct, it's cheaper than a pharmacy. And best of all, no more awkwardness. We've got a special deal for our viewers and listeners. Go to bluechew.com. Get your first shipment free when you use our promo code Pakman. That's Pakman. Pay just $5 shipping. That's BLUE chew.com. Promo code Pakman to try it totally free. Blue Chew is the better, cheaper, faster choice. And we thank them for sponsoring the David Pakman Show.